Good morning, everyone, and welcome to the WellMed Charitable Foundation Caregiver Teleconnection. This session is a very special one, entitled What We Can All Learn from the Experiences of LGBTQ plus Caregivers, Implications for the Future of Caregiving. And I want to tell you a little bit about our expert presenters, because these are people who really know what they're talking about and who can share not just their experiences, but from a national and international level of what's going on in the world today. Lucy Barylak received her master's degree in social work from McGill University and has dedicated her career to supporting caregivers. Lucy was the founder and longstanding manager of the Caregiver Support Center, a multi-service respite program for family caregivers. In 2003 and 2012, she received the Queen's Jubilee Award presented by the Canadian Home Care Association, awarded to her on the basis of her dedication to caregivers. Let's see. She also developed a national coalition to support the issues and challenges facing informal caregivers. She's published numerous articles and has presented at major conferences on her research findings. Lucy is also a liaison supervisor at the School of Social Work at McGill University. And Dr. Elliot Montgomery Sklar is a public health professional focused upon supporting the health of the public through academic work, research, and service. He has led healthy aging programs for seniors and for caregivers in Canada, the United States, and via the web. Dr. Sklar is an associate professor of healthcare sciences, at Nova Southeastern University in Florida. He publishes and presents his work internationally, which is focused on the complexity of issues related to aging and caregiving. So you have a very incredibly expert group here, and I just want to welcome you two and thank you so much for being here today. And please take it away.
Thank you, and welcome to all of our participants and those viewing our program. Our theme today really focuses upon LGBTQ plus caregivers. However, there are lessons to be learned for all caregiver groups. And that's because LGBTQ plus adults become caregivers at a higher rate than their non-LGBTQ plus peers. Data shows us that about 1 in 5 LGBTQ plus adults become caregivers versus 1 in 6 in the non-LGBTQ plus adult community. But when you consider the much smaller segment of the population who identifies as LGBTQ plus, that small difference in the proportions of 1 in 5 versus 1 in 6 becomes much more significant. Some other data shows that as many as 60% of LGBTQ plus adults become caregivers. It's really hard to know exactly what the data is because many people don't want to self-identify, number one, as LGBTQ plus in data that might be national, like census or CDC data. And secondly, we know that caregivers also often don't self-identify. So that becomes much more challenging to know what the true data is. But one of the key questions is why do LGBTQ plus adults become caregivers more commonly? Now, some of these reasons include not having children or having fewer children, and also being single later in life, leading to people being caregivers for family and for what are called chosen family. So these are friends or other close people in one's life. And we're seeing these trends actually across our entire population. So we have a really unique program today because we have a lot to learn from the experiences of LGBTQ plus caregivers. What we really think it boils down to is something that we are calling inclusive caregiving. And that'll be a central theme in our program today, recognizing that there is diversity among diverse groups of caregivers and that their unique experiences also shape their caregiving experience and journey. It's also important that we recognize that people have a lot more in common than we have in terms of differences. So when we look at caregivers or inclusive caregiving, It's a concept that we really want to promote because there are a lot of learned lessons across different communities and experiences. So today we're really flipping the script on issues and challenges that we discuss as they concern LGBTQ plus caregivers. We tend to focus a lot on the unique issues and I'm sorry, and challenges that our community faces when it comes to caregiving for a variety of reasons, like those I mentioned: less children, more financial strain, strained or complicated relationships within families. We talked last week about more mental health concerns. So, all of that said and done, we do have a lot to teach one another and other caregivers, and we wanted to capitalize on the strengths and the experiences of LGBTQ plus caregivers, especially at a time when we might be feeling marginalized or invisible. Now, maybe this is an ideal way in which our community can come together as a resource, a model to others in resilience, and as a society in living longer, having less children, and aging, perhaps alone and single. We have a lot to teach future generations.
Thank you for that, Elliot. Good morning, everybody. You know, the concept of inclusive caregiving is important because caregiving is inclusive by nature. It includes all people from various walks of life and with diverse experiences. We need to remember that. And there is often similarities in the experiences of different groups of caregivers that we might not consider or it might not be obvious to us. In our past programs, we've looked at different communities of caregivers, especially younger caregivers who face unique challenges. If we look at the millennials, which is not an easy word to say, caregivers um, who care for older adults, they also face a unique set of challenges shaped by their age, their economic context, and social expectations. You know, their challenges are similar to those experienced by the LGBTQ plus caregivers, but not for different reasons. There are, so let's look at there are key issues they commonly encounter the same. So one of them is financial strain. You know, student debt and low savings. Many of them are still paying off student loans, trying to build savings and making, caregiving can be very expensive and very burdensome. They may face career disruptions, some reduce work hours, take lower paying jobs, or exit the workforce entirely to provide care. There's also out of pocket costs. They often spend personal funds and medical supplies, transportations, or home modifications. Likewise, many older LGBTQ plus caregivers experience the same challenges. Like many older adults, many seniors have limited savings for caregiving related costs like respite care or hiring private help. As we move forward, more people are living longer and needing more care due to chronic health conditions. This is such an important consideration for all adults at any age or point in your life. We need to be thinking about long term care planning and saving much more than we do.
50 with the whole potty.
All right, little interruption. Okay, so just having said that, and that sort of really resonated with me. Um, yeah, we do have to start planning for the future. It's so important, especially as we age. So let's look at the what is the balance between work life, care balance for young adult who are caregivers. You know, what they're trying to do, there's career building conflicts. Many are in the early to mid stages of early development. They just started to work, and caregiving can interfere with advancements or job security. There certainly could be burnout, managing caregiving alongside work, and potentially lead to stress and exhaustion. You know, the lack of workplace flexibility. Not all employers offer caregiver leave, flexible hours, or remote work options. We see this a lot among older LGBTQ plus couples who may not be married and are thus not entitled to benefits under the Family Medical Leave Act. So these are important things to think about, and you can start seeing how, even though they're younger, some of these really relate to one another. So we did talk about this last week, but I want to kind of reinforce it again. What are the mental and emotional stresses that comes with caregiving? Many young caregivers really find themselves isolated, believe it or not. They may feel socially disconnected from peers. They don't go out as much, who aren't caregivers. Many LGBTQ plus caregivers also experience this, which was a focus of our program last week. Now, there could be role reversal. Caring for a parent or older relative can bring emotional difficulties, especially as family dynamics shift. Many younger adults are having children later in life or not at all. And just like the LGBTQ caregivers, if you don't have children, then it is something assumed that you will be a caregiver to an older parent or family member because the assumption is that you have more available time on your hands. I'm sure some of you can relate to that. Lack of preparation. Many younger caregivers are unprepared for the emotional and logical demands of caregiving. This also happens for the LBGQ plus caregivers, many of whom don't even know that as a community. LGBTQ plus adults become caregivers, as Elliot said, more than their non LGBTQ peers. Planning for disability or aging isn't a very sexy topic. People don't want to address it or plan, and then all of a sudden it appears. As well, there are really limited access to support resources, even though last week we did mention a lot that there are more now, but I'm talking about in general. So there's really low awareness. Younger adults may not know about or qualify for government or community support services, whereas many older LGBT caregivers don't want to necessarily reach out for services due to discrimination or not feeling welcome or included. This takes us back to the notion of inclusion, of inclusive caregiving. As well, most caregivers, moving forward, they look at the things and they're not quite so sure of what it is exactly that's out there. LGBTQ caregivers or diverse caregivers. This is even true for gender. We talk a lot about the fact that there is a place, there's a certain service called, quote, a place for mom, which is a caregiver support for long-term care, but there's no advertisement for a place for dad. There are cultural gaps in caregiving expectations, particularly relevant for people from culturally diverse backgrounds who may face cultural pressure to provide care without outside help. Now, healthcare navigation challenges. Wow, that's really a difficult one. And most caregivers are faced with it. It's complex system out there. In the US, even in Canada, younger caregivers are more savvy with technologies using healthcare today, like booking appointments online or through the app, and using telehealth to have virtual healthcare consults. But navigating insurance and healthcare system and coordinating appointments and care can require a lot of patience and a lot of time, which can be challenging for younger adults juggling many responsibilities, especially if they're working. It's also been something that the LGBTQ adults have had to deal with in other unique ways. For example, feeling uncomfortable, as I said before, in healthcare setting where there's a fear of judgment about one's sexuality or gender identity. Understanding and coordinating elder care across the healthcare system is difficult, and then There's insurance, long-term care systems. Not easy for the LGBTQ plus caregivers. This can also be challenging if you don't share a last name with someone. So you might be in a couple relationship for 20 years, but you're not married, you don't share a name, and there's a lot of difficulties that come with that. As well as the lack of geriatric care access. In many areas, there's a shortage of geriatric specialists or elder specific services. So many caregivers simply don't know where to turn, something that many caregivers of all walks of life experience together, even if their paths are unique. So what we're trying to say is there's a lot of similarities when you're a caregiver, regardless of whether you're LGBTQ plus or not. There are many similarities because it's just that kind of a journey that everyone is going through. And there are so many more parallels between the LGBTQ plus caregivers and other experiences. Caregivers for different diverse backgrounds and communities. So as Evelyn said, I'm going to want to ask you guys a question. What are some other challenges that you have experienced or think could be helpful for other caregivers? So, if we can open up the lines, because we might have missed some, we'd love to hear from you.
Hey, folks, we want to hear from you, please. You can press *6 if you're on the telephone, and I will see that you have done that. And if you want to just unmute yourself or leave a chat, we will do our best to answer or to respond to it. So I think you did a pretty good job of covering stuff, Lucy.
Covered a lot, but still, there could be some personal um, situations as well. I'll
Right.
just mention one if, while you're thinking about it. It didn't happen to me personally, but when I went to the dentist's office, a new dentist, you have to fill out a form, and there is, female or male, that's it. There was no, and I was just thinking because I was, we're always, we do this, a series around June, and I'm thinking about, wow, that's something that really needs to be changed. So after my appointment, I very politely spoke to the secretary and said, it would be a good idea to include a few other pronouns. So, I found that very challenging. If you are in that community, it would be something a bit offensive. And how do you deal with that?
Well, it's a very challenging and sensitive issue, especially here in the US, where we have those pronouns being removed from data collection of national data like census data, which we use to identify what resources might be needed for which populations, as an example, in which communities. So there are some very dire consequences, in my opinion, to not collecting that appropriate data, and it goes far further than just someone not feeling welcome or included. And I do see we have something here in the chat. What is caregiver burnout? Lucy, do you want to touch upon that?
Sure, you could do just as good a job as I can. I'll try. Well, burnout really means is that you are first and foremost emotionally exhausted, and you're just feeling overwhelmed with things that you might have been able to accomplish. There's just a sense of overwhelmness of this is just way too much. It could also affect your mentally as well. You can find yourself being depressed, unmotivated, isolated. It's like so many things that can happen when it's very different for every person, but you're not yourself, and it's just taking a toll on you. You can become more angry, you're not caring for yourself. So I don't know if I missed any, but it's just very unique. It all depends as who you are, whether in fact, if you've ever had any mental health issues in the past, they could have, all of a sudden you feel that they're just exaggerated more. You're just not basically coping.
And if you actually spend a little bit of time looking up caregiver burnout online, you'll find a lot more information, resources, even visual aids that can help you determine, where you might be in that caregiver burnout experience. I think what you said is key, that it is a little bit different for everyone, and that's important. I think as a whole, too, we have so much still to learn. And as we say, when it comes to caregiving, nothing stays the same. That can be true for caregiver burnout, too. You might be feeling that at one period of time, but that might pass. It might come back. Now, a lot of the research that we have to lean upon, and something we were just talking about, including pronouns and things like that, precedes the pandemic. And we know as caregivers how the pandemic really changed a lot about what we believe about healthcare. It also refocused different concerns about caregiving and also about long-term care. So I did want to share a little bit of data with you, not too much, and then we're going to move into something that I'm excited about, and I think Lucy is too. What we put together a list of 10 things that we think that everyone can learn from the experiences of LGBTQ plus caregivers that we've collected over the last several years of running this series each June. But I personally work with the Center for Disease Control's Behavioral Risk Factor Surveillance System data a lot. It's a public data set, and it's one that we were just talking about, pronouns being collected as an example. That's where this type of data goes. It's a very large collection of national data that's collected each year based upon self-report of US residents. And it's a source of data used for many studies that get published in the National Institutes of Health. These surveys help to form the basis of what limited knowledge we have about certain health issues or risk factors associated with specific communities of people. I had the opportunity to work with the 2023 data, which is actually the most recently available data. And what I found was quite interesting in playing around with some statistics. As we had learned from previous research about sexual orientation, there has been an association with health disparities in terms of health behaviors, health outcomes, healthcare access, all of which highlighting the need for health promotion policies and programs for sexual minority communities, including among older adults. But when we look at the 2023 data, prevalences that were calculated across measures of health among adults 65 plus and separated by self-reported sexual orientation. So in this case, LGBTQ plus and straight, there were many commonalities, and I wanted to share them because I thought that this was actually quite encouraging. There were no significant differences for having a dedicated healthcare provider, so that speaks to the issue of access. No specific or statistically significant differences for flu, pneumonia vaccinations. So those are key indicators of preventive health. There were no significant differences for physical inactivity or for exercise. No significant differences for excessive drinking, which is very interesting because a lot of previous research, especially around mental health, shows higher substance abuse, but not among the adults 65 plus, gay versus straight, bisexual, lesbian, etc. No significant differences either for frequent physical distress, high health status, or obesity. Now, yes, there were some statistically significant differences in areas like mental health, which was the focus of our program last week. But I think that as we think of inclusive caregiving, these similarities are important to highlight because so often we're focused upon differences. So there are a lot of similarities among adults 65 plus who identify as LGBTQ plus and those who do not. And I wanted to simply highlight this in the most recent data. We know there could be some flaws here, but I think it is encouraging to show that maybe some of these differences are lessening over time. And as we say, we're more similar in our experiences than dissimilar. It's actually a Maya Angelou quote. Now, we really wanted to share some very important lessons uh, for other caregiver groups, but also for healthcare providers, social workers, senior aides or companions, really society at large. These lessons highlight resilience, community building, and the need for inclusive caregiving frameworks. So Lucy and I put our heads together, spent a lot of time on this, and put a list of 10 things that we think we can learn from the experiences of LGBTQ plus caregivers. Now, this is from our thoughts and our experiences, as I mentioned in running this series, I think for the last 8 or so years. So number one is the importance of chosen family and non-traditional support networks. Now, the lesson here is that care does not always come from biological ties. LGBTQ plus caregivers often form caregiving circles with friends or chosen family, as we said, and this teaches others the value of building broader support systems, especially in situations where family support may be limited or absent. And a second lesson is resilience in the face of structural barriers. Now, what does that mean? It means that we need to adapt. We've all heard that saying, the tree that doesn't bend is the tree that breaks. Caregiving is about adaptation. Caregivers always find that they need to adapt their lives, their care for a loved one as their health may be declining, for example, but adaptation and advocacy go together. And I think that this may be something for us LGBTQ plus community members that we learn early in our lives, simply because we have to navigate in the environments in which we may be living, which may require some advocacy on behalf of ourselves and also some adaptation. So I think that it's a great lesson here because we're reminded of the importance of advocacy all the time, even in showing up to perhaps gay pride events this year as an act of solidarity and advocacy. LGBTQ plus caregivers navigate systems that were not built for their identities or their relationships. Lucy, you gave an excellent example of intake paperwork. So that teaches others the importance of persistence, advocacy, resourcefulness, speaking up when systems fail patients and caregivers. And this is such an important lesson for all caregivers. We talk about advocacy a lot in the context of our programs. And by nature, the role of illness and attached caregiving is always changing, depending on circumstances and the needs of both the care recipient and the caregiver. Lucy always reminds us there are two people in every caregiving relationship. Now, there's also a need for culturally competent and inclusive care. And to me, the lesson here is that care environments should respect diverse identities. Now, in our programs over the years, I've taken snapshots of searches that I've done in Google using Google Images. And this is one I did just last week using the word caregiving. Now look at all the pictures that you see as what is reflected by caregiving and think about that for a moment. LGBTQ plus caregivers are often more attuned to ensuring that care settings are respectful of gender orientation, sexual orientation, identity, pronouns. This reinforces the broader need for affirming care for all older adults, particularly those from marginalized communities. So when we look at these images here, I don't know about you, but I don't see too much diversity in terms of gender, in terms of depiction of LGBT couples, in terms of diversity as a whole. So we still have a ways to go. And I think that using these image searches are a great way to help to teach others, even if it is AI or technology. This is what's reflected by what our society believes about caregiving, which is flawed and not inclusive. And I think another important lesson is the awareness of legal and policy gaps. I think it's something we're all very, very sensitive to right now. And the lesson here is that legal protections matter. Lucy mentioned Family Medical Leave Act earlier. That's a very important benefit for caregivers if you need to take some time off to care for someone. Also, you can be married, you can be gay, you cannot share the same last name. My husband and I have been married for 10 years, together for 20. We have different last names. And when we go to healthcare appointments, that can cause some questions. And I've had issues before where I have not been allowed back if he's in the emergency room, for example, and I have to get someone to go and request his consent to, give me permission to go back there. Now we've since learned how to navigate around that, and we have forms in place and living wills and things like that. But that's where the importance of planning is all the more significant. And as we have said, LGBTQ plus caregivers frequently face challenges like being excluded from medical decision making or lacking legal recognition in relationships. And this is one of the reasons why we have so many older LGBTQ plus couples who are not married, who've been together a very long time, but the reality of marriage only became available about 10 years ago, or the possibility. And so for perhaps a lifetime of a couplehood, this was something that was never really thought much about. And this brings up the importance of legal planning, like I said, power of attorneys, wills, living wills, and advocating for policies that really recognize all family structures. Now, another important lesson is inclusivity and intersectionality in caregiving. And we certainly know one-size solutions for caregiving do not work. They don't work for healthcare either. We might have best practices, but we know that things need to be tailored for certain communities. It's something I've learned since I was in graduate school here in South Florida, because what might work for one community, even the name of an evidence-based healthcare program, might not jive with another community. So it's important to be sensitive. LGBTQ plus caregivers often experience overlapping challenges. So for example, being a person of color, being LGBTQ plus, perhaps being older or having low income. The combination of experiences emphasize the need to approach caregiving policies with a perspective that looks at a lens that considers the varied lived realities of people. And I think this is really at the heart of inclusive caregiving, something that we believe very much in.
100%. Okay. Creating safe, inclusive spaces, which is really a lesson to be learned. Everyone benefits from safer caregiving environments, no matter who you are. The LGBTQ plus community has long advocated for an environment in environments where individuals feel safe being their full selves. This principle benefits all caregivers and care recipients, reinforcing the idea that inclusive environments improve mental health and trust, which is really very, very important. Then there's the power of visibility and storytelling. Sharing diverse caregiving stories reduces stigma and broadens understanding. LGBTQ plus caregivers often face invisibility in public places. Their willingness to share their stories helps expand society's view of what caregiving looks like and empowers others to speak out and seek support. Because when you're a caregiver, you're dealing with a lot of the same issues all the time. Now, the whole idea of community mobilization, which is really a lesson to be learned from the LGBTQ plus adults, they know how to mobilize and have done so historically to come together and support one another. LGBTQ plus caregivers and seniors serving organizations have been spotlighted across the many years. You know, they hold Pride of Caring programs each June for Pride Month. It's been an honor to see so many community organizations, move forward because of their willingness and determination to really push that without even having resources. They have featured guests from Texas, from Montreal, my city where I come from, Canada, Illinois, Colorado, All that started because people wanted to make their communities stronger. This is so important at all times, but also during times when many government programs are seeing cuts, especially now. LGBTQ plus organizations have always been ahead of the curve in being creative and engaging community members and in putting on some amazing fundraising events like drag bingo, community talent shows, arts and all kinds of arts events, and etc. I can go on and on and on. Now, one of the things that I feel very strongly about is the whole idea of advocacy, which is so important, and the lessons that we learned. So much in the realm of caregiving deals with advocating for your care recipient and often for yourself. LGBTQ plus adults have a lot more experience with advocating for yourselves in different ways. Over the years, we have heard from LGBT plus caregivers and professionals that support them about how crucial advocacy is in their journey and how it has been the case. This is also true in the case of caregiving and having experience with advocating for yourself or someone else can be helpful as a skill to build upon during the experience of caregiving. It's important for both LGBT Q plus and non-LGBTQ plus caregivers to reflect about their own experience with advocating for yourself or for someone else. Maybe not in the healthcare situation, but in something else. So whatever it might be, advocating is really important. So I want to ask, what did you learn from the experience and the skills and tools that you found helpful? So, Elliot and I both want to ask you, in the spirit of inclusive caregiving, we wanted to leave our 10th lesson to include your ideas. So, what are some of the strengths and lessons we can share? What did our list not cover? I'm sure that there are many other lessons, or if you wanted to speak to any of the points we've mentioned, please feel free to chime in. So, let's hear your voices.
For those of you who are on the phone, just dial or press *6, and I have my little website. I can see that you've done that, but we'd love to hear from you. We know you have some good information for us. You're holding back.
There was a question in the chat asking, what is caregiver burnout?
I think we got that one.
Yeah, we addressed that a little bit earlier.
Okay.
Yeah. I just think that doing this exercise and sort of presenting it really puts a lot of emphasis on what the LGBTQ plus community has done to promote so many areas where we can definitely learn all these amazing lessons. And just going back to the whole idea of inclusion. When you're a caregiver, it doesn't matter where you come from because you're going.
I love that word. I love that inclusivity or inclusion word. And it always reminds me when I hear it of when we do talks on dementia, that, everyone says, if you know somebody with dementia, you know one person with dementia. And it's the same in terms of their health care, their care plan, their future planning. Every person is an individual and needs to take care of themselves and share that with others, share their plans so people know what it is that they want and they need and, how they want to live to the end of their life.
100%. Okay, so if you're just thinking about things, we'll have a few minutes at the end. There's a lot to be learned and to continue learning. We learn something every day. So to summarize some of the broader lessons for all caregivers to be learned from the LGBTQ plus community, we thought that this slide might be helpful as a takeaway of things that we have discussed today. Okay, so LGBTQ Q plus caregiver insight. So there's a broader application, building chosen family support, importance of non-traditional support networks, navigating unwelcome system, empowering yourself and others through advocacy, need for inclusive environments where it's safe, more affirming care for everyone, where you don't have to be afraid to be yourself, storytelling to foster visibility, reducing stigma and all caregiving spaces. I mean, when you tell your story, no matter who you are, other people can actually see you as who you are, a person who's telling a story about your life and what it means. And many times you can actually identify with that and say, my God, I'm going through the same thing myself. So, this is what is so interesting about all these and how um, everything kind of comes together. So we're not so different. A lot of us, we're all the same. Some of us have go through more difficult times than others. But if we can sort of include everybody and not exclude anybody, it's a way of really it's part of humanity and who we are. So I don't know, Elliot, if you'd like to add a few words.
Absolutely, absolutely. I think every year that we have run this series, we have heard from at least one caregiver who felt like they were the only member of the community in a caregiving space. And we heard that last week from one of our participants who I believe might be joining us today. So that notion of inclusive caregiving, back to that, is just so important. And it's not something that we think about when it comes to caregiving. We take for granted that whatever is out there is inclusive. But if you spend a little bit more time looking at, for example, advertisements, pamphlets, brochures for caregiver support programs, there's a lot of use of the color pink. There's a lot of gender. I'm sensitive to that as a man, not just as a member of the community. And I think that this is true for caregivers of all ages and generations. So remember that, if you are feeling alone in a caregiving space, we do have more to share. We do have a lot of things we may have learned that can be of value to others. And it might be helpful to feel like that is more perhaps of a meaningful focus than feeling isolated, because I think it can help us advocate for change. Many of us remember our experiences during the pandemic as an example, and how isolating and alone we felt at the very beginning and scared. And do you remember those Zoom happy hours that we all started to enjoy and connect with friends and others? Well, that started actually in the LGBT community. There were a lot of bars and performers and things like that felt that there was a need for that to happen in an online forum, and that was how it began. So there's a lot that we as a community can feel proud of in, I think, being creative and adapting, as we were talking about. So I hope that you'll take some time to think about things that your life experiences may have taught you that may better prepare you for the role of being a caregiver, no matter what walk of life you may come from. Now, as always, we want to leave you with resources about the experiences of LGBTQ plus caregivers, but also resources to find support. You don't need to worry about writing all these down. We always share a copy of our presentations. And anytime you see anything underlined, it is hyperlinked, which means that you can click on that and it will take you directly to the resource. So these are some very valuable national resources here. I do want to share once more our community hotline, helpline, and community organization list, because we put this together as a really exhaustive uh, resource, we think, that can be of help for many caregivers. We really believe strongly in crisis hotlines and helplines, especially the 988 mental health crisis hotline. It's anonymous, it's free, you can reach it by phone or by text. There is some talk of it being defunded. And so Canada has made their mental health hotline now available in the US for free. So I want to share that, and that's 1 1-877-330-6366. Again, 1-877-330-6366. And as always, the WellMed Charitable Foundation can be reached at the coordinates here. We will turn it over to Evelyn and Minerva, who have some information about upcoming programs. And we're going to welcome you once more to think about any questions or comments that you may want to share with us.
Great, thank you. We do have a couple more really good presentations this month. We hope you will join us on June 17th. Let's see, we have a Spanish one, and I don't know if you're there, Minerva, but I forgot to ask you how to translate that. But it is, I think it's about planning and
Hold
anticipating.
on, my computer's deciding to be slow.
Yeah, I think it's about the need to plan for the future.
The importance of planification and the challenges for the health of the caregivers with Leslie Martinez.
Thank you, thank you. And it's for the Spanish speaking community, it's all in Spanish and questions will be answered in Spanish. So it's such a nice opportunity. And then on the 19th, we have the optimal brain aging with Jamie Cobb Tinsley, talking about the different kinds of things that you may have heard about in the past, but we can never, we're always learning more with all of this neuroscience going on. Learning how the brain connects and how it keeps us young, or how it, keeps us not thinking right. So that should be a really good one. And then on Wednesday, the 25th, you don't know what you don't know, which I think has a lot to do with how we support our older adults and their caregivers who are having, issues. I think it has a lot to do with the advocacy that Lucy was talking about, and how we find what we need and make sure that we can get it. So those are some of the things that are coming up. Always great planning on the part of WellMed Charitable. Thank you so much. I'd also like to say that if you are not registered for this, you need to call that 866-390-6491 number, which is the WellMed Charitable Foundation, and get registered so that you will get the slides that Lucy and Elliot are kind enough to share with us. And especially with all of those incredible resources, nobody's better at accumulating resources than those two people are, and putting them together, for us, so that when we're in a panic mode, we have some place to go to look and find, basically what it is we need and how we can get there. And I also wanted to thank Elliot and Lucy so much for the great job they always do. I loved your list of 9. And maybe now, does anybody have number 10 or want to contribute to number 10?
Well, I would say awareness. I know we talked about that, but in general, there's a much more awareness nowadays, I think. What do you think, Elliot? Are we
I would
more?
agree. I think there's more advocacy, there's more awareness. There's also a larger number of younger adults self-identifying as LGBTQ+. So that's a shift as well. So that could be a reflection of people feeling more comfortable in self-identifying. I think that's one of the challenges that we have when it comes to research and data about seniors. Because of their lived experiences, they're less likely to perhaps feel comfortable self-identifying. And I think maybe for me, number 10 might be lived experience, because we know certainly that the lived experiences of older adults in our environment has not been the same as it has for people of younger generations. But I think it was so important for us, in the spirit of inclusive caregiving, to leave that one open. And open-ended, because that answer might be different for different people. And I want to encourage those of you who may be participating or watching this at a later time to think about your number 10 and what that might be for you.
Great. Well, thank you both so much. You always do a beautiful job for us. And I want to thank all the participants for what you do every day. And you are the backbone of long-term care in this country and probably the world. So thank you, thank you, thank you. Also like to thank the WellMed Charitable Foundation for all of the wonderful topics that they bring to the table for us, for the ability to find these great experts to present the topics. And if you go back onto our caregiverteleconnection.org podcasts, there's just a treasure trove of information back there. Many of them now for over the years have been for LGBTQ plus community. And they're all for caregivers and they're all different topics for caregivers. So help yourself to those. You'll be lucky, to find what you will be lucky and find what you need there. So thank you all very much. Unless somebody has something else they want to add now. No. Okay. Thank you for being with us. We
Thank
hope
you.
to see you again soon. I am going to go ahead and stop the recording now and hope you have a great day.
Bye, everybody. Take care of
Thank
yourself.
you all so much.